Hi, my name is Norman Whitten, and I'm from Suffolk, Virginia. And for those of you who don't know, is in the greater Hampton Roads area of the great state of Virginia. So anyway, I'm married, have 7 children of our own, 1 adopted, and I happen to be a Chick-fil-A owner-operator in that store and have been for 46 years. So that's a little bit about myself. It began when I noticed that I had a problem with what I thought at the time was a gallbladder. I was having a gallbladder attack. I was doubled over pretty good, 102 fever, in bed, pretty sick. Recovered, but realized that that's probably not something that we should ignore. So I went to my local doctor, who checked me over real close, listened to all my symptoms, got me out on a table, pressed all over my abdomen, hit my gallbladder, and which it sent pretty good shockwave through me pretty quick. And the doctor said, "You still have your gallbladder?" And I said, "Yes." And she said, "I think I found your problem. Do you have a surgeon?" And I said, "I really don't." But we talked about that, and she said, "Well, before you go, I want to take a moment to take a picture and just see and make sure that this is what we're dealing with." And of course, I got an MRI. And the MRI showed a completely different picture, and it showed me with a lot of lesions on my liver, some problems with my pancreas. Biopsies later showed that it was a neuroendocrine, and it was. But the fortunate thing that a CAT scan showed that it was only in those 2 areas, so it had not metastasized. It had only been in those 2 areas, or had partially metastasized. Going to a doctor and oncologist, got all that set up. We worked with warp speed to try and get a lot of this stuff done, knowing that the time can not be in your favor in these things very quickly. We found out that ours was a slower growing one, so it gave us a little bit of time to think about what we wanted to do. But we realized that we probably should act quicker than slower. And my wife had gotten a video link from a guy by the name of Dr. McCullough, who we happened to be a customer of his, and he was having an interview with a doctor that we had never heard of, Dr. Goodyear, before. And it was talking about, can holistic medicine cure cancer? It's a great interview, and it prompted us to contact Brio and ask more questions. And we asked a lot of questions. We looked at other clinics too, but we found a lot of the things culturally common with this clinic that we really liked. We liked their approach. We liked their integrative approach, because they do more here than just holistic medicine. They can do things beyond just your vitamin C and your mistletoe and things of that nature, which I really liked. The decisive factor was that we understood that it was 7 weeks, and that the ruler, to be cured, was told to go dip in the Jordan River 7 times. And we were like, oh, okay. I mean, it just seemed like so many things were pointing to us coming here for a lot of reasons, that being one of them. And we were just like, okay, I mean, do we have to, I don't need someone to write it, magic hand to write it on the wall. The Lord has already said we need to be here. So we came. When I was diagnosed, I was told that I had a neuroendocrine cancer, and the oncologist actually told me it was not curable. That sounded pretty ominous when we had it, but the good news was, he said, at the current time it's slow growing, but that could change, and that they could do chemo, they could do hormone therapy, there's some things they could do, or as he stated, at your age, you can do nothing. Not being a do nothing kind of guy, we started looking, and Brio came into the crosshairs of where we were looking, and that's how we got here. Right, I've been here about the 7-week regimen, and my condition has improved considerably. When I came here, I could actually feel and have pressure and a slight amount of pain in my liver from the lesions that were on there. You could actually feel them. The doctors told me how I could feel my stomach and feel them through my stomach, and those have gone down considerably, and in some cases they feel like they've gone away, and the pain that I've felt in my liver has dissipated to some days I don't feel it at all, and some days it's almost like I'm faint, like I'm feeling it, but it's not there. It's kind of strange to not be feeling it, where before 7 weeks ago it was a constant reminder that there was something growing inside of me that I didn't like very much. The treatments I've had here, Brio, have been kind of amazing. Some of them have been machines that are called PM or PEMF machines that do a lot of things that I probably don't really understand, but some of the ones that I do understand were like the barometric pressure chamber. I had a friend who I unfortunately lost his life to cancer, survived a lot longer because of his involvement in that machine. So I've loved getting in that machine. It's quiet. I can get an extra hour of sleep. Some of the really interesting ones that I have oddly enough enjoyed the outcome was the low dose chemo that we do here, the IPT. Most people tolerate it real well. I've tolerated it extremely well. And as a matter of fact, the days after IPT and the days after my chemo were my best days physically and emotionally, and even some like arthritic pains I had in my hands would go away for a whole day. Really strange, really strange. So I've really enjoyed those, and will miss those because where I'm going back home, they're not going to have them. Coming to Scottsdale was a throwback, because I had been here 30 years ago, and the town has grown up considerably, and we got to do, we rented some cars on the weekends, got to do a couple of fun things, and it's been really good. It's been really good. Scottsdale's a great place. There's if you have to come with a caretaker, there's lots of shopping. There's more places to eat you can shake a stick at. It's a great place. We've really enjoyed our time here, and now the fall is coming and the temperature's dropping and it feels very comfortable. I actually wore long pants today. So, but yeah, it's good. It's a really good environment. We've enjoyed our time here. The care that I found at Brio was really unusual in the medical sense, because typically when you go to a doctor's office, you sit in a lobby for a while, and then you sit in a cubicle for a while, and you wait for a doctor, and you talk to the doctor for 15 minutes, you get a script, and you go home. Here it's been completely different. Somehow the staff here and Dr. Goodyear and all the owners that have been here have been able to mix hospitality and medicine together at a level that is very uncommon. Being here, the doctors are here pretty much every day. You can literally walk up to the doctor's office, knock on the door and say, "Hey, I got a question," and they'll stop what they're doing and take as much time as necessary to answer your question. And I've had a lot of questions, and I've got a lot of really good answers, and it's been wonderful. And the staff here, hey, I need a pillow, or do you need a blanket, or do you need something? It's almost like being in a hotel in a lot of ways. Very, very unusual, and it's been a real good experience. And it's almost sad to say I'm leaving. I feel sad a lot because some of the people who come here are really sick, and you get to see them walk out. And I've been a part of a lot of people's lives who've been here, 7 weeks, and seen them come in wheelchairs and walk out. That's cool. That's a God thing. It's really a God thing. I'm not your person who complains. I'm a business owner, and I struggle with people that I love it as a business owner. I love it when people have legitimate complaints or suggestions, constructive things that can actually bring a better experience to that person. And so I very, very seldom ever reach out and just complain, because I understand the complexity, the difficulty, the speed, the stress of the job environment, which those customers, don't, a lot of times don't. don't understand. Sometimes I would like to go. I like to go to your office for a few minutes, you know. But here it's been great. And if there was anything, it was minor, and it was like, you know, these people here they're killing themselves working the hours that they're doing, and they're looking at death on the face every day, and struggling in the fight just like us. Who am I to complain? I would say that looking at cancer treatment, looking at a group like Brio, who has the word integrative on the top of the marquee is what they're looking at, got my attention, because it wasn't about just eating vegan. It wasn't just about, you know, doing certain things or taking certain vitamins. It was about everything from low dose chemotherapy to, you know, different types of, you know, commercially available drugs. They attack the cancer not with a 10-pound hammer, but with lots of little hammers along the way. So we didn't kill my immune system in the process of trying to kill the cancer. And as someone who was a novice at trying understanding it and not being a doctor, I could pick that out and ferret that information out and realize that that's what I needed to do first. That's my first line of defense, is to make a hostile work environment for cancer in my body. And that's what I wanted to do first. My wife agreed, and my family. If it comes to a hammer someday, we'll put a hammer. But for right now, we're just giving cancer hell, you know, to pardon the phrase. But that's what we're doing. I think that some of the advice that I was given was sooner than later. Come sooner than later. Don't wait. Cancer's not waiting on you. It's trying to kill you, and you have to understand that. And you're in a war for your life, and you have to have a mentality like that. Don't wait. Don't wait till the water is up to your neck, and you know you're in a bad situation. Come as quickly as you can. Do what you can, and get to a place that's gonna have an integrative approach to this. Not just one, but many different approaches and things that they can bring pressure on that cancer that's trying to kill you.